All right, it looks like we'll get started. I want to say good evening. My name is Monica Cruiser, one of the associate principals here at Amity Regional High School, and I will serve as this evening's moderator. This webinar presentation will start first with Dr. Byers sharing some information about the reopening plan, and we'll follow it up with some questions and answers that we have some already that have come into us, and we'll take your questions if you put them in the Q&A portion of this webinar. We have about an hour for this webinar and hope that we can answer most of your questions for the 21-22 school year. And at this time, I'll turn it over to Dr. Byers for her presentation to start this off.
So good evening, everyone. Thank you very much for taking the time to be with us here tonight. What I am going to do is hopefully go through a presentation briefly for maybe about 10 to 15 minutes. It's really a summary of some of the information that has been sent into in the letters that you received during the summer. But it also captures the questions that were often asked of me most frequently once those letters went out. And so I'm hoping that the presentation at least addresses many of the questions that you may have as you come to the webinar this evening. And then once my presentation's done, we will open it up to the rest of the panelists to answer additional questions. So if you just give me a moment, I will share my screen. All right, so I think probably the most important thing that I do want to emphasize this evening is that even though we are still in a period of the pandemic, the guidance that is coming from the State Department of Education and the Department of Health is really trying to emphasize that with the proper mitigation strategies, the 21-22 school year can look different than it did last year. And so I think what we're going to do is highlight what some of those differences are going to be for your students and for our staff as they come into the building. So a couple of the things that we are going to see, first of all, and I sort of thought about this in terms of walking through your kids' day. So if they are taking a school bus either to or from school, or if they're taking buses for activities like field trips or athletics, school buses have been determined to be public transportation, and as such, they are under a national order that passengers and drivers must wear masks when on public transportation. So all of our students need to be at the school bus with their masks on and ready when they get to board the bus. Just like last year, our bus drivers will have extra masks available in case a student forgets them. And they will need to keep the masks on for the duration of the trip until they arrive at the school building and get off of the school bus. Most likely they're going to keep those masks on too for a little while as they enter into the building. We are returning to full in-person, full days of school. That includes the high school, which many of you remember was on an early dismissal schedule for all of last school year. We are able to do that by accommodating 4 lunch waves at the high school, using additional seating outside, as well as in the district office presentation room. We can return to 2 lunches at the middle schools, but we will be using the cafeteria in the outside area, which we did last year, as well as the additional use of the gym for making sure our students are able to eat and spread out during the lunch period. We are going to be offering a free breakfast and lunch for all of our students. Going to look a little different between the middle and the high schools, and you'll get further information about that. But this is part of a federally funded program to provide all students with free meals for the duration of the upcoming school year. We will be reopening all of our locker rooms. So this has a significant impact on our health and PE classes, as well as our after-school athletic program. The middle schools are going to resume using lockers the way that they have done in the past. Certainly that's available at the high school as well. But as we know, many students at the high school choose not to use the lockers. One of the biggest changes is that the Department of Public Health is now recommending a 3-foot spacing between students, more if we can do it. But what they are really clear about is that the 3-foot spacing is ideal, but if it impacts the operation of the school so that we can't have a full return of students, then schools are not required to meet that 3-foot spacing. In other words, at all of our reopening meetings, they essentially say, do the best you can with the space that you have. And additionally, we will not be cohorting students at the middle schools. They will be returning to their team model and to rotating classes and having different students in their classes throughout the day. The state is very clear that they have an expectation that all students return to in-person instruction. And so just to kind of address some things that were in place last year that are not available this year, we will not have synchronous remote instruction. There is not the option for voluntary remote learning that parents can opt their kids into. We cannot have remote learning on inclement weather closings, so we are back to our traditional snow days. However, we will be able to provide asynchronous remote learning for students who are quarantined or isolated as a result of COVID-19. We are going to still be required to contact trace, and we will have to quarantine students or staff if they are unvaccinated. At this point, the quarantine period is 10 days. A shorter quarantine is at the discretion of the local health departments, but after meeting with them, the parameters around that are fairly complex, and it's not aligned with some of the other organizations that we work with. So our quarantine period will be 10 days, and there is no testing out of quarantine. So once you are identified to be in quarantine or isolation, it's 10 days for both cases. Quarantine is not required for individuals who are vaccinated, provided that they are still feeling well. If they are not feeling well, then quarantine would be recommended. Additionally, testing is recommended on day 3 to 5 after the close contact for those vaccinated individuals. But again, I would stress that they are not required to quarantine. You will be hearing about school districts that are providing what they call COVID screening at the schools. This has been available or open to elementary districts on a voluntary basis, particularly because elementary age students are unable to be vaccinated. Our district, because we are a 7 through 12 district, will not have COVID testing available at the school. One of the things that has come through most clearly from the State Department of Education is that vaccination and the proof of that vaccination is the best way for students to participate in full in-person instruction and activities. So if we have proof of vaccination, a student or staff member is not going to be required to quarantine. For parents, you have a couple of options. You can either turn that proof of vaccination in now, and we will be building the database that will allow us to very quickly filter out your vaccinated student from quarantine lists so that you won't get that phone call or that letter that says they need to quarantine. You can also have the option of turning the proof of vaccination in at the time of quarantine. But what this could result in is perhaps a delay of maybe 1 or 2 days as you sort of get the phone call, then you have to go find the vaccination card, bring it to the school, turn it in, and then put the student back into the classroom. To provide your proof of vaccination for your student, you can either provide a photocopy of the actual vaccination card, or we have noticed that some of our local pediatricians have been including the vaccination information on the student physical, and that is also acceptable proof of vaccination. Amity is going to host an on-site vaccination clinic for all Amity students and staff. If you recall, in the springtime, we were able to partner with North Haven School District and QVHD, and we offered student dedicated clinics in the spring. That really addressed our kids who were in that 16 to 17-year-old range, because at the time, the vaccine was only available to them. By the time the 12 to 15-year-olds were able to receive the vaccine, we were very close to the end of the school year. And in some cases, the clinics would have actually required vaccination after the school year had ended. And so we did not provide those real specific student clinics in the late springtime for the 12 to 15-year-olds. So we will be hosting a clinic actually at Amity Regional High School. It is a Pfizer vaccine clinic so that it can address the needs of our 12 to 17-year-old students. The dates of that clinic will be September 23rd and October 14th, which happen to be early dismissal days. So high school students will be able to receive the vaccination in the morning while they are still in school. And then middle school students, if they have some transportation to the high school, can get the vaccination after that early dismissal in the afternoon. Please know that students cannot just show up and get a vaccine. They will need parental permission or have parents present in order to receive that vaccine. And indeed, much more information is going to be coming shortly about the on-site vaccination clinic. Athletics are resuming as normal. As a matter of fact, they have already started at this point. CIAC requires the 10-day quarantine period that we are also following, and that is only if a student receives a negative test somewhere on day 7 or 10. If the student does not receive a negative test, then CIAC requires a 14-day quarantine for our student athletes. Masks are still required under the CIAC guidelines for indoor sports and spectators and coaches. However, masks are not required for any of our outdoor athletics. Our extracurricular activities are going to resume as normal. So our student clubs and some of our other after-school co-curricular opportunities. We will be providing late buses at the end of the day at our middle schools and our high school. And in some cases, the student clubs, because they are under student leadership, may still decide to meet remotely, but they can also certainly meet in person after school. All school districts are under Executive Order 13A. Executive Order 13A is the governor's requirement that everyone wears masks regardless of vaccination status inside of certain school settings, or inside of certain settings, which includes schools. As I noted at our board meeting, executive orders essentially function like a law. And so the expectation is that everybody who is coming into a school building is going to be wearing a mask unless they have a medical exemption, very similar to these circumstances with masking and face coverings last year. The executive order is set to expire on September 30th, 2021. However, this executive order has been in place now essentially since March of 2020. So it is, and it continues to get extended. So, we don't know what the situation with masks and face coverings will be after that September 30th date. But to start the school year, all of our students and staff will need to wear face coverings when they are inside of the school building. And as such, we will continue to provide mask breaks throughout the day for the students, again, in a manner very similar to the provision of mask breaks during the last school year. Throughout the course of the year, you would have seen Friday updates posted onto our website. And this is information that comes from the state database. So currently, the status of Bethany, Orange, and Woodbridge from the latest update, which was August 19th, shows you that we are around probably 65% of our 12 to 17-year-olds who have received a first dose of a vaccine, and probably closer to about 55% of our students who are fully vaccinated at this point in time. You can also see what the percent positivity rates are for our 3 towns. New Haven County is, again, still in the low category for leading and secondary indicators. I know that last year you received many letters from me indicating when there was a positive case in schools. This is no longer a requirement that we send it for every single positive case that happens. So hopefully you will get fewer letters from me during the course of the school year. However, in order to keep you informed, we will update on a weekly basis the number of positive cases that are in schools. Additionally, all of this information is available on the CT data portal. So everything that you see here on the screen, as well as the school reported cases, can be easily accessed through that data information center. And at this point, that essentially is the end of my presentation. So we will move to our question and answer session with the people that we have here this evening. So thank you.
Okay, Dr. Byers, just if you can go back and clear up, because there's some questions about that presentation that people might have missed in the beginning. And it says, one of the questions is, what if your child has proof of having COVID do they still have to quarantine? So have had COVID in the past.
So I'm going to probably end up deferring to Patty on this a little bit, but if you had COVID, your sort of non-quarantine period, if I remember correctly, was 90 days. So if they had COVID back in December of 2020 and they come back to school and are considered a close contact the first week of school, they are still going to have to be required to quarantine because that evidence of having had tested positive for COVID has a finite limit on that. So I don't know if Ms. Masella, if you can confirm that I am correct in that.
That's my understanding as well. The only thing we could do that I can do is check out with the local health department to see if anything has changed, but that's the way it was.
Okay. And there was a follow-up question about CIAC. I'll give this one to Mr. Goodwin. So it said, how will a positive case be handled in sports? Like, so say if the student is positive, how long do they quarantine? That was a question.
If a student is positive, all the information can be found in the CIAC Return to Play Fall Guide. We have it posted on our athletics website. You can also find it on the CIAC. But if a student does test positive, they're going to have a minimum of 10-day quarantine. They will need a doctor's note to get them back. And if once they do get back, there's a return to play protocol similar to a concussion. It's a 7-day process, and it's spelled out in the document, starting with low exercise and going all the way up to full contact if the sport has it, or full return.
All right, perfect. And one other question regarding your letters, Dr. Byer. Will I still receive a notice if my student has been vaccinated but exposed? Will I be considered a quarantine or a close contact?
So if your student has been vaccinated and we have proof of that vaccination, at this point, they would not have to be quarantined. And so we wouldn't necessarily notify you. We can ask the health districts if that's something they would recommend, but if your student is still feeling healthy and well, and they have been vaccinated and we already know that, then they just aren't even going to be they're going to be filtered out of our quarantine list, and you wouldn't get that notification.
Okay. And those vaccine cards go where again? That was the next question. Who receives those vaccine cards?
I can take that. They're going to come to the nurse's office or the health office in the 3 schools, and it'll be in file in part of their permanent record for their health.
Okay.
And certainly for right now, I know that all the schools have kind of like a box set up where they can take not just the vaccine cards, but any physicals or other medical information that's coming in. Although our nurses are going to be back in the buildings starting on Wednesday, combing through all of that information, but it can all be brought to the school itself.
Okay, and a question about the vaccine clinic. How is the Amity? Do they have any responsibility for the effects of the vaccine?
So the vaccine clinic is actually going to be run by the mobile vaccine clinic that comes through Griffin Health. So other than providing the space for the vaccine clinic, Griffin Health does the entire rest of it, including the parental permission, including monitoring the students, administering the vaccine. So it's really just a matter of providing a location for Griffin Health to set up and to administer the vaccine to individuals who wish to receive it. And it really was an attempt to hopefully make it more convenient for anybody who still wanted to get their student vaccinated, but just hasn't quite figured out how to do that in a way that's easy for their family.
Okay. Mrs. Mann, this is going to go to you. It's about the high school schedule. I see some questions about the new bell schedule. Can you kind of review that? And can you talk about what FD stands for?
Certainly. So we, as Dr. Byers mentioned, we have included a 4th lunch wave. So in order to accommodate that, obviously we need to start lunch a little bit earlier so we don't run into the end of the day with 4 lunch waves. So we've shifted the lunch waves from 5th session to 4th session. Historically, we had lunch during 5th and 7th period, but now we'll have lunch during 4th and 6th. Due to the additional lunch wave, where we have 4 lunch waves, which means that our maximum number of students in the cafeteria at any given time would not exceed 400, whereas traditionally we are anywhere from 500 to 530 students. So this makes it a smaller lunch wave. That session period will be a bit longer, and so students will have some additional time built into that session. So they will have lunch, they will have their 53-minute class, and then they will have a student success planning time. There'll be more information about that that'll go out in this week's newsletter. The FD that everyone saw for the high school on your schedules was a indicated full day, which was a separate type of schedule than our regular A through D days. We've actually removed that because it was messing up our schedules, the way that schedules looked on PowerSchool. So those have been removed. So I encourage everybody to go back onto PowerSchool. I know that you got your list of classes in your schedule for your child's order of classes through a PDF on Monday. The order is still the same, but if you want to see the letter day schedule, it's easier to look at it through Unified Classroom on the PowerSchool portal. So that's the better way to go and take a look at that. And just as a reminder, and again, this information will be in the newsletter this week, Mondays on the August 30th, we are having the 30th and the 31st are 2 early dismissal days to align with the rest of our districts. And so at the high school, we'll be having special programming on Monday. So no students are actually going to run through their classroom schedules on Monday. They'll be in their Spartan seminars and in those groups throughout the day and kind of travel as a group to our various activities and programming. And then on Tuesday, we will be running a straight 8 schedule, which was the reason that we had the full day schedule on there, which we're not going to use anymore. So students will be going through all 8 periods and meeting their teachers. So they'll follow a day schedule for 1st through 6th period, and then 7th and 8th will be a B day schedule. Students are going to get all this information on Monday. We're going to go over it thoroughly in our Spartan seminar groups, so they will all understand that. We'll start with a regular A day as of Wednesday next week.
This question goes to Patty about vaccine cards. They're asking if they could have them scanned and sent and emailed to the nurses. Is that possible?
We prefer to have them either brought in a copy of them, or I guess email would be okay. A lot of times the emails, if people don't send them in the correct format, it's not easy for us to print. And sometimes fax comes a little skewed. So the best thing is to make a copy and get it to the nurse's office or the health department at the high school.
All right, perfect.
Definitely. And we learned that last year as we started to get vaccine cards in. But if it's more convenient, unlike medication that a parent has to bring in, a student on the 1st or 2nd day of school can just bring in a photocopy of their vaccine card, just as long as they remember to get it to the school nurse so that parents don't have to make an extra trip out to the school. But a hard copy is definitely preferable to any electronic copies because they come in so many formats and sometimes are not clear or easy to read.
And back to Patty, some people they heard that part about the health form about pediatricians putting the date on there. Can you speak to that? Like how some pediatricians have done that? Some people think that there's a spot to fill in. Can you explain that there's not? It's only done.
I don't have the form right in front of me, but I'm sure there's a spot on the immunizations for other, and they would either input the COVID and the dates, the first vaccine and the second that it was completed. I have not seen that yet. I've just gotten the immunization cards. I have not seen it on the health form.
Okay, Dr. Tracy, this one's for you about school computer use. Is it mandatory, and when do students get their computers?
So we've already passed out the devices for the 7th graders, and some families weren't able to come out to those drop-off days. So 7th graders will get their devices on the first day of school. Same thing for 8th graders. They'll get their devices on the first day of school, and I think that's the same for the high school. I see Miss Mann nodding. I didn't know that for sure, but that's how we do the device distribution. And if there's any kind of issues with that, we could always reach out to our technology department to help us. Any parents that are worried about a device or anything like that, be assured you'll get them on the first day of school. The other question was mandatory use of devices in school. We do require that students use the device that we give them. And it's for one reason, really, that we have a software that's installed on there that allows teachers to exchange documents with students in real time, allow them to do some video conferencing, and allow the teachers to basically control the computer screen to the extent that kids aren't on different apps or on doing something they shouldn't be doing during class, but then also to kind of stop the screen during instruction so teachers can be sure that the students are tuning into the live instruction that's going on in the classroom, and then be able to unpause that screen when they need to. So we do require that the students use our devices that we give them in school.
Okay, thank you. Follow up back to Mrs. Masella. The question is, what about a student who is COVID positive? How will that be handled? I'm trying to figure out that question. A vaccinated student who actually gets sick.
Okay, if a student who is fully vaccinated gets sick and is COVID positive, they will have to isolate for the 10 days, just as if it was their first time with COVID.
Okay, thank you. Question to Mrs. LaPlante about students and attendance. Will students lose credit in classes if they're required to quarantine or isolate?
No, they're actually going to get a special attendance code if they are on quarantine or in isolation due to COVID. So they will be expected to participate asynchronously and log into Google Classroom and get their work and complete their work. But it will not go against their absences for loss of credit.
Okay, thank you. Mr. Brandt, a question about specialized instruction. If my student is quarantined, will specialized instruction be provided?
Sure thing. So what we're going to do is take that in a case-by-case basis. My office communicates directly with the school nursing office regarding all students who are required to quarantine. And if we identify that a special education student has been required to quarantine, we'll work directly with their case manager to determine what that specialized instruction may need to look like during that period of their quarantine time.
Okay. Mrs. Burke, a question for the middle school. We talk about cohorts not cohorting. Are you able to explain why there's no cohorts, or Dr. Tracy as well, this year in the middle school?
Well, first of all, given the fact that, the mitigation strategies, there are a number of them that we are employing to prevent any kind of spread. We are following those guidelines. And in terms of cohorting, although the students are mixing, going from class to class, they are still fully masked. They are staying 3 feet apart. We are able to limit the amount of close contact that happens during the school day. So again, the CDC at this point in time did give us some leeway and guidance in order, stressing the fact that a return to a more normal instructional model was preferable. So the decision was made to cohort students while implementing all the other mitigation strategies.
Okay, thank you. Go ahead, Dr. Tracy.
I would only add to that even last year during COVID, and kind of the cohorting model that we were using, students still ate lunch together, and that was although we had 6 feet apart or outside, but students did mix and did share space. So, and they also switched classes for some of their special classes last year too. So this is obviously a little bit more than that being uncohorted, but last year there were definitely times throughout the year and throughout the day, students say that they were not cohorted.
And to follow up that, and Mrs. Mann can also speak to this about the protocols, the mitigation strategies that are used between classes, what's available in the classes to clean. Anyone can.
Sure, we're going to continue many of the mitigation strategies that we had last year. Obviously, masks are required whenever on the bus or inside, at least for this time being. We will be contact tracing, as we said, and we are going to be, having teachers let us know about assigned seats, and if there are modifications to those seats, we want to, as Dr. Byers said, we want to focus on educating our students and providing them an appropriate education. So there will be moving around possibly, but we will take note of that when that happens. And we're gonna encourage kids to stay distanced as much as possible and as operationally feasible, and then obviously continue with proper hand hygiene. We have, we do have access to sanitizer and wipes and bathroom, and then, obviously, as I said earlier, our modified lunch waves. So.
Okay. This maybe Dr. Byers answer this one. Snow days, are they remote days?
No, they are not. The state has been very clear that there are not opportunities for remote learning this year in any way, shape, or form, including snow days.
Okay. How will any of this impact our music program here at the high school and middle schools? I'll go to Mrs. Mann first.
Well, I can take that question first really easily, in the sense that all of the requirements that were in place for music last year, including the additional distancing, the bell covers, the special masks, all of that has to be in place again this year. That being said, we will resume music programs and instruction to the manner that it was pre-COVID. And as much as we can, we will have that music instruction outside, weather permitting. And now I can turn it to Mrs. Mann and Dr. Tracy and Mrs. Burke.
So in order to accommodate those mitigation protocols, we are using our space as efficiently and effectively as possible. So including the Brady Center for regular instruction, because we are able to space students out there. As Dr. Byers just said, the first place that we will send our students in the music classes is outside. And then when the weather gets prohibitive, then we will use the Brady Center as well as all the bell covers and those kinds of things. And depending on if there are particular facilities that are not available, then we will modify instruction as needed. But we have every intention of having performances and after school activities as well that include music.
And the same follows for the middle schools, using alternate locations, bell covers, spacing, and certainly using other areas throughout the building, and perhaps splitting classes as need be, just to keep spacing appropriate.
Okay, question about late buses. Will there be late buses in any of the schools?
So at the middle school level, we'll have late buses on Tuesday, Wednesday, and Thursday till 3 o'clock. That is so students have time to stay after school for extra help with appointments with teachers. At the middle school level, those buses will not accommodate any kinds of after school sports, because typically the practices go past 3:30. So transportation will be needed for the most part for after school sports.
At the high school, we will also be having late buses on Tuesday, Wednesday, Thursday at our normal time at 3:45 roughly. And there is one bus for each town. So they all leave between 3:40 and 3:50. They also do not accommodate most athletics, as the athletic programs get going really between 2:45 and 3. And practices are certainly not concluded by 3:30 or 3:40. And so students will have to arrange for, just as they always have, rides for athletic after-school activities, but almost all other after-school activities, with the exception of programs that start later, such as theater, they can be accommodated by staying after school and then taking a late bus.
Okay, a lot of questions. I'm going to go to Mr. Brandt about, can you clarify if a vaccinated student will be notified if they're a close contact?
Sure thing. So any student who's identified as a close contact will be notified through our school nursing office and in consultation with the administrative staff. Only those students who are unvaccinated will be required to quarantine, though, but we will notify vaccinated students and their families if they've been identified as a close contact, because they will need to monitor for symptoms. And it is recommended that they receive a test between days, COVID test between days 3 and 5. So we will be notifying all individuals who are a close contact that they were a close contact, but only those who are unvaccinated will need to quarantine. Vaccinated students will monitor for symptoms, and it is recommended that they test between days 3 and 5.
Okay, that clears that up. Back to,
Ms. Cruiser, can I add to that?
absolutely.
In athletics, the same will apply. However, in the CIAC plan, a vaccinated, fully vaccinated student athlete who is a close contact will not have to quarantine, but will wear a mask until day 3 to 5 when they can test and test negative and then remove that mask. If they choose not to test, they must wear the mask for 14 days. So they would have to wear that, and that goes for obviously indoors where we wear a mask all the time, but it would also be required outdoors.
Can you explain what a close contact is in sports, and Mr. Brandt, what it would be in a classroom?
Excellent question. In sports, the CIAC, in consultation with the DPH, continues with the 6 foot for 15 minutes contact rule.
And I'm actually going to let Mrs. Masala explain the close contact rules for in school.
You're muted.
Oh, Patty, you're muted.
Sorry about that. Yes. And I'm going to have to defer to Dr. Byers only because I'm not sure if it changed from the 6 feet, which we used last year, down to the 3 feet, because that's what we're using this year for distancing, for social distancing.
So actually it's the CDC. It still defines a close contact just the way Mr. Goodman referred to it. Anybody who is 6 feet or less next to a person who's an index case for greater than 15 minutes. However, the CDC and the state DPH have provided one exception for schools, and that is for students when they are in a classroom only, when they are seated less than 3 feet from each other and fully masked. So in the case that we have students in a classroom, they are all sitting at desks. They are sitting next to each other for more than 15 minutes, presumably. They are all wearing masks. As long as those students are 3 feet apart or more, they would not be considered a close contact for the purpose of the school setting.
Okay. Mrs. LaPlante, parent nights. Can you speak to what parent nights open house will look like, and any other counseling open parent nights that you have?
Yep, so the counseling department at the high school will have 2 nights in September. The first one is senior parent night, which is scheduled for September 2nd at 6:30. That will be in person, where a senior parent will meet with their school counselor to go over the whole process for post-secondary planning for students who are looking to attend college. We will be limiting attendance to 1 parent per student because we'll be in smaller spaces. And then financial aid night will also be held in person in our Brady Center on September 21st.
Okay. Question about middle school sports, Mr. Goodwin, will they be as normal as they can be?
Yes, that's the short answer.
Okay. A question about cleaning of desks. Dr. Byers, can you talk about mitigation strategies for that, and also air purifiers?
So with respect to the air purifiers and the HVAC systems, we're following the same recommendations that came from DPH last year. Air purifiers in classrooms actually are not helpful when we have as robust of an HVAC system as we have in place at our 3 schools. Our 3 schools are going to have their settings at the recommended levels for the maximum amount of fresh air circulation into our classrooms and our large spaces. And it certainly exceeds any of the requirements, minimum requirements that are set by the Departments of Public Health during the period of the pandemic. As for the cleaning of desks and surfaces, and even the service of lunches, there is the State Department of Public Health, as well as the CDC, has found that there is a very low amount of transmission of virus on solid surfaces. And so their reopening plan actually suggests a return to our normal cleaning protocols that we had in place pre-pandemic, as well as our traditional method of food service that we had pre-pandemic, because they do not have evidence that that is a mitigating strategy that is actually impacting the spread of the disease. So we will return to our normal cleaning protocols and to our normal food service. I think we are all more in tune of paying attention to high touch surface areas in places. And so I think we will continue to do that just because it was probably a smart thing to do all along.
Okay, Mrs. Burke, this is the middle school question and could also go to Dr. Tracy. If a middle school student has to quarantine, how will they get their work completed?
Google Classroom. We're going to use Google Classroom as an asynchronous way for students to access their assignments. And of course, for the duration of the time that they're out, so the quarantine is 10 days, we're going to allow the students 10 days to make up that work if they have to need some extra support from the teachers when they get back to school. But short answer is we're going to use Google Classroom like we did last year.
Okay. Also to Mrs. Mann about the extra help, and there's a question about, you know, last year people maybe think that we didn't get to all of what we were supposed to teach last year. How do you see this playing out this year, and what supports are in place for students this year?
Yes, so we, I think that we were actually in a pretty good spot in terms of, I know that there's been lots of discussion about, COVID slide and those kinds of issues. We have actually been working on that throughout the duration of the pandemic, including through much of the summer. We had a variety of different programs that ran throughout the summer for many of our students, rising 7th graders all the way through seniors who were finishing up their graduation requirements. We will continue to have, and this is true not just at the high school, but across the district, so my colleagues can speak to it at their schools, but we will continue to have interventionist help available to all students. So at the high school, we have a literacy interventionist, a math interventionist, a science interventionist, and then a testing coordinator. So if a student has to make up a test or has to have extra time on an assessment, that goes to that testing coordinator. We've had those interventionists in place, but they will be certainly something that all students have access to. We also are going to be running a program after school that is targeted for students who are really struggling with various academic and scholastic skills, and that will be accessible through the counseling department. And also those students can use our late buses in order to access that program. And then our teachers are available for extra help after school until 2:39. They'll be here at 7:24. Students at the high school are going to be allowed into the building at 10 after 7. We will continue to not allow congregating in the hallways, but they are encouraged to move about and go to their classes. We are not going to have any directional arrows in the school, so they are free to go to their classes however is most efficient. But aside from being in the cafeteria, a small group, small amount in the cafeteria for the provided breakfast, students are expected to go right to their classrooms, and so teachers will be there at 7:24. And so the expectation would be that they would be able to get themselves accustomed and accommodated at that time. And so just as we have always had, we would expect teachers to be able to support students within the classroom, outside of the classroom, as I said, through that student success planning time during the 4th session. So we will certainly work to address that. And then within the classrooms, teachers are very aware that they are going to be, kind of seeing where kids are, as they do every year, but really trying to, take some diagnostic aspects of where their students are academically, as well as socially and emotionally, and so that they can work to meet the needs of every student who enters their classroom.
Still, there's some confusion about the health form. Can you explain that a parent should not write that on it? That would only be that the doctor, Patty? Here.
Yes, anything on the health form under the part 2, which is the physician section, should only be written by the physician, and it's either signed by the physician and they also have a stamp. So a parent should not write in that part. The only thing a parent can do is on the first part where it says parent section, they can fill that in.
Okay, is there and I guess this would go to Dr. Byers, is there a low metric threshold that we would use to go back to education and situations as normal educational environment?
We have not received anything like that from the State Department of Education or the State Department of Public Health. So I cannot answer that question. I have no idea.
And is there going to be any on-site COVID testing during school hours?
No, there will not be.
This was a high school question back to Mrs. Mann. If a student is quarantined, will remote learning be just going to Google Classroom, or will there be online instruction?
So we are, going to be consistent throughout the district. So there's no synchronous online instruction. We would expect students to work on their academics when they are through Google Classroom, and teachers are going to be updating Google Classroom as they were last year. And then they will have time to make up assessments or things that can't be done outside of the school when they return from their quarantine.
Mr. Goodwin, will spectators be allowed at sports indoors like basketball?
Yes. Yes, they will.
Dr. Byers, if the COVID rate continues to rise, is there a number where we would go to fully remote learning?
At this point, again, the state is pretty strong on the idea that students need to return to in-person instruction. And the state statutes that were passed this summer really make that very, very clear. So outside of either an executive order or a really probably unique circumstance that would affect only our Bethany, Orange, and Woodbridge towns, we will be having in-person learning for the foreseeable future. That could change, but at this point, remote learning is not an option for school districts moving forward.
Question, are teachers and staff required to be vaccinated?
Well, I can answer that yes. If you were watching the news last week, the governor put in another executive order. This is Executive Order 13D, which does require individuals in certain settings to receive a vaccination. And that does include all personnel in K-12 school districts. There are exemptions, either religious or medical exemptions that can be obtained. And it's something that only came out last week, so we are still working on that. But at this point, yes, you can follow the press briefings from the governor and his press releases that explains his Executive Order 13D.
This is for the middle school principals, and it's more about just extracurriculars. Are sports right after school, and what is the process for signing up for clubs and activities at the middle schools?
So yes, sports are after school. There's a form that came out last week in my news blast and will come out again in the newsletters we send out this week to sign up for athletic clubs, so athletic teams after school. And as for clubs, those are usually student generated. So most of those will start when school starts, as student interest is gathered by the teachers and usually over the course of the first few weeks of school. But those will also be after school activities that will happen. I don't know, Kathy, if you had more to that.
So again, clubs, depending on the time of year, different clubs run at different times. Those clubs are announced on the morning news and then posted in our weekly news blast. The clubs, there are no tryouts for clubs. Students simply have to sign up for a late bus to attend. The extracurriculars, the sports, most of the sports will take place after school, but that is going to be on an individual basis because there are some sports programs that will start later in the afternoon, and students will have to go home and then get a ride back in order to participate. Again, an information letter is going out, letting parents know what the fall sports are and how they can participate.
Okay.
And there is a section, a middle school section on our athletics webpage that has the sign up form so that you can get emails quickly, and also the Form 1 and Form 2, which you have to bring into the school nurse and have approved prior to trying out for a fall sport. At this time, we are having some difficulty finding middle school coaches, so we do have a few teams that are in jeopardy of not running this fall.
This is a question that probably was answered a little bit earlier, but Mrs. Mann, can you talk about how remote instruction will happen? Is there remote instruction or instruction for quarantine students? Is it synchronous or asynchronous?
So again, consistently across the district, we are not going to be doing any remote instruction that is synchronous. Students, if they are out of school for any given reason, would be expected to complete work if they're, as long as they're healthy enough to complete work following along in Google Classroom, where the assignments will be posted that can be done at home, and then they would be given time when they return to school to make up any assignments or activities that have to be completed in school.
Okay.
And I think what our charge is to really provide that in-person instruction. And when teachers are trying to juggle between both the student that's at home on the on their computer and all of the students in front of them, both of those groups suffer. So we are really committed to making sure that our students who are in person are getting absolutely the best possible instruction that they can, and that our teachers are able to deliver the quality academic that we have always come to expect in Amity. And again, I think the idea of students staying home and then coming back and making up work later has been a way that schools have always operated, and we are accustomed to that and can handle and manage that. Additionally, if we have students who are vaccinated, then the number of individuals who are in quarantine is not going to be as significantly high as it was last year. Additionally, if we have students who are vaccinated, the number of students who are going to be isolated because they have a positive case isn't going to be as high as it was last year. So, part of the reason why we have this shift is because we are really expecting that we are going to have most of our students present in person and are going to be learning in our school buildings and classrooms.
And as a follow-up, as we almost come to a close, about the mask rules, can you go back to that for people who signed on late about the mandate, the governor's mandate about masks?
Yes, so right now we are under Executive Order number 13A, which identifies certain settings where everybody is expected to wear a mask regardless of vaccination status, and that includes school buildings. So beginning on the first day of school, we will expect all of our students and staff to be wearing a face covering when they're indoors. We will still offer mask breaks to our students, much in the way we did last year, because they are going to be wearing the masks indoors. And certainly if we are able to have activities outside, the masks are not required. This executive order is in effect through at least September 30th. And after that point in time, we'll have more information as it comes from the governor's office.
Okay. Middle school principals, are there any changes to morning drop-off, afternoon pickup?
No significant changes other than we ask that students enter the building at 7:25, no earlier than 7:25. Buses will enter through the bus loop and the parent drop-off remains the same. We may alter dismissal in that in the past, pre-COVID, when dismissal came, everybody just headed for the door, so to speak. We'll have a more controlled process to limit the number of students in the hallway at dismissal time.
Same in Bethany. 7:25 drop off. Security will be out front, or one of the administrators will be out front to motion when it's time to come into the building and start the day.
Mrs. Mann, at the high school, any changes to morning drop-off and afternoon pickup?
It's going to be the same as last year. So we'll have, and actually all in previous years, we will have parents enter for drop off. We encourage kids to take buses, or if they're able to drive, then they can certainly, and they have a parking pass, they can drive and park in the back. Anybody who is not on a bus or a staff member in the morning has to enter from the North Pease entrance and follow a one-way traffic flow down to the side of the building. Students can be dropped off in the same range, anywhere from the stop sign on the side of the building all the way back to the to right before the kind of the back entrance to the parking lot. And students should get out there and they can go on either the back or in the front. They will not be allowed on the side. And so those will be our two entrances for students. And then at student dismissal at 2:18, we will ring the bell and students will go out to the front for the bus dismissal. And we will, and students who are being, who are driving will go out to the back. And then students who are waiting to be picked up will wait in the front, and the line will follow the bus dismissal, similar to how they were. So we ask that parents do not come to pick up their students until 2:25. And if they are going to get picked up at school, it'll be in the front as it has been in the past, but it'll be after the bus dismissal. And I know there was also, the passing time is going back to 5 minutes, simply because we no longer have directional arrows in the hallway. And so we will follow that.
Quick question about Friday for freshmen, about Link Crew. Are there maps that students will get when they go into their Link leader groups in a tour?
So on Friday, the ninth graders will follow, they will get a tour of the building. That's part of the Link Crew orientation. So I encourage all ninth grade parents to come to our ninth grade parent orientation night tomorrow night for Link Crew. It's specific to Link Crew. It's not about the rest of the school or about the academics or those kinds of things. It's about the Link Crew program. But that's at 7 o'clock tomorrow night in the main gymnasium. And on Friday, the students will get, they won't necessarily get a map. I'm not sure if they're going to be handing out maps to the students, but those are certainly available in the main office. And on Monday, as I said earlier, Monday, no students need to have their schedules except to know where they're going to. On the schedule that was sent home in the PDF form on Monday, it said homeroom. That's really your Spartan seminar. So all students should report Monday morning to Spartan seminar, their Spartan seminar rooms, which is where they will spend, that group is what they will spend their day with. And then on Tuesday, when we go through the full schedule, there will be all the Link Crew leaders will have their specially colored shirts on, and students can always ask any Link Crew leader or any adult in the building how to get to specific classes. And as always, we reserve the first couple of days in terms of attendance and tardies for kids to find their ways through the hallways. And before the end of the week, students pretty much know where they're going. So we are aware and amenable to that.
I think that question, you explained about Spartan seminars just on Monday morning, and then the kids will figure it out. So it is now 7:30. And that concludes this evening. If Dr. Byers wants to give a closing statement and question.
Well, yes, I'd like to thank all of you who were able to come and attend this evening. We appreciate the questions and the interest that you're showing in how we're reopening the schools. I'd also like to thank our panelists who took the time this evening to answer questions. And most importantly, we can't wait for your kids to come back to school on Monday. We are really excited to see them and to have them back in our buildings and to welcome them back to the 21-22 school year. So thank you very much.
All right, thank you. Have a good evening.